Hi there, I'm Victor Zhao, President of the National Academy of Medicine, and I'm so excited to welcome all of you today. I'm sorry that I couldn't be with you in person, but I'm cheering you on, members of the National Academy of Medicine, Clinician Wellbeing Collaborative, guests, and everybody in DC and those joining us online. You know, the NAM is dedicated to improving health for all. Specifically, our Action Collaborative on Clinician Wellbeing knows that improving health must start off with supporting health workers as well, so we can provide the best care possible. Over the last 8 years, this collaborative has done much to address burnout and support clinician well-being. We work with health systems, government, legislation, IT vendors, so that we can reduce the workload for our clinicians, reduce administrative burden, and improve EHR efficiency and support mental health needs. We develop a national action plan and launch a campaign to mobilize all health organizations to work collectively to advance well-being. So today we're here to celebrate the second annual Health Workforce Wellbeing Day, a day that we and others launched as a recurrent opportunity to support health workers and reflect on our progress as a nation. So following last year's public event that we held, the Senate passed a bipartisan resolution designated March 18th as a National Day of Awareness. And the citation says, in quote, recognizing the seriousness of widespread healthcare worker burnout in the United States and the need to strengthen health workforce well-being, end of quote. Well said. So at the meeting last year, many health professionals were inspired to share their personal stories. And from all the social media that we can track, we're able to have 14 million impressions and reach nearly 2.2 million people with our collective voices and our call to action. That's really impressive. And I'm just so glad that the message is out there. This year, we're seeing organizations across the country not only joining us this day, but getting inspired to celebrate the healthcare workers locally and making their own event. I'm also greatly impressed by having more than 400 health organizations in the US who joined this campaign. These change makers have been using the national plan of NAM to be the blueprint for progress. So in this plan, we outline 7 priority areas that have the potential to catalyze change for our health workers so they can thrive, deliver care environment that fosters the well-being. So today, in preparation for national observance of this Workforce Wellbeing Day, we'll hear from the change makers who are paving the way in several priority areas, such as supporting mental health, engaging effective technologies, institutionalizing well-being, and recruiting and retaining health workers. You know, I couldn't imagine how powerful this community would become when we first launched our collaborative 8 years ago. It started with leaders from ACGME, Tom Nasker, the CEO, and AAMC, Darryl Kirsch, CMO, who came to me and said, let's put this collaborative together. It's now grown to encompass dozens of professional societies representing the full spectrum of health workforce. Of course, we can't forget the leaders around the country who continue to invest in the workforce, the well-being champions who lead this work every single day, and the researchers who are constantly improving our knowledge and tools. So I hope you leave today with a sense of excitement, how important it is to stay committed to our mission. And importantly, how action that all of you take, all of us take, day to day, can sum up to real positive change over the course of a year and over the course of many years. Certainly, I think it gives me hope. It gives us hope for a national movement going forward. Lots of people to thank. I'd like to thank my co-chairs, Prem Cipriano from International Council of Nurses, Derek Kirsch, the previous CEO from AAMC, and Deb Weinstein, the current CEO from ACGME. They are the co-chairs. Thank you. I'd also like to recognize our past co-chairs for their great contributions. That's Tom Naska, previously the CEO at ACGME, and Vivek Murthy, the former Surgeon General. They are just great. With that, I want to invite my good friend Vivek Murthy to speak with you all. Vivek, as you know, has made well-being the centerpiece of his work during his term as Surgeon General. And he truly believes in the ability of people on the ground to drive change. So I want to thank him for his leadership as co-chair of this collaborative, for his great work as Surgeon General, and certainly looking forward to continue work with him. And now let's listen to his reflection, the time with us, and his vision for the future. So Vivek does not need any introduction, and I turn over to him, the Surgeon General, the former Surgeon General. Over to you, Vivek.
Thank you so much, Victor, for that kind introduction and for your friendship and your tremendous leadership over the years. And my thanks also to the National Academies of Medicine staff and the Clinician Wellbeing Collaborative for your work to address a cause that we all deeply care about. When I was in medical school, we used to meet in the evenings in a deserted wing of the school to talk about burnout. It was the kind of thing that was whispered about in hallways and never really spoken about openly because it was seen as a source of weakness. Now, this came at an extraordinary cost, to clinicians to be sure, but also to our patients and to the morale of our profession. Thank goodness things are changing. I'm proud to say in the last few years, we have shifted the conversation on clinician well-being, and we have done that together as a collaborative. We are now talking more openly about clinician well-being. We're studying it more rigorously. We are making more changes to policy and practice that slowly but surely are beginning to help clinicians. This kind of change is not easy. It has taken courage to speak up and to make this a priority. You and a growing number of our colleagues decided to stand up and speak up for a new way forward, and that is starting to bear results. The collaborative has helped in very concrete ways, helping institutions change culture in our hospitals and training programs and increase investment in well-being, to make it okay to ask for help and to make sure that help is available when people need it. We are pushing forward changes to reduce administrative burden, both in healthcare systems and in government. I was proud that our collective efforts helped CMS issue final rules last year to help reduce the burden of prior authorizations for Medicare, Medicaid, and CHIP programs. In 2022, inspired by so many of you, I issued the Surgeon General's advisory on clinician well-being to draw the nation's attention to the issue of burnout, which had been made worse by COVID. And just before that, the Lorna Breen Act was a moment when Congress also recognized the need to act to address clinician burnout. Now, we're all here because we know there's much more to do. I'm especially worried about the profound challenges to health and human dignity that we have seen in recent weeks. As our colleagues come to terms with policy changes that threaten Medicaid coverage, clinical research, and efforts to address disparities in care, as they watch a measles outbreak spread in Texas during rising anti-vaccine sentiment, it's hard not to worry. Collectively, these challenges take a toll on the spirit of clinicians. It's why these challenges matter to this collaborative as well. To meet this moment as clinicians, there's one more thing that we need: each other. There's an old saying that you come to the table for the cause, but you stay for the community, because in moments of hardship and despair, community is everything. Community is what we need as clinicians too. It diminishes our pain and sustains our action. This is a time for us to reach out and support each other, to check on each other, to listen to each other, and to help each other in small ways, whether at home or at work. Kindness and compassion remain the essential tools of our time. In the end, the moral test of society is how well it cares for all its people, especially the ill, the vulnerable, and the disadvantaged. But societies don't pass these tests by default. They require people who are willing to speak up courageously and unapologetically for the dignity and well-being of others. People who are willing to defend the value of every life. People who are willing to use their moral compass to light a path forward. You and our colleagues have the power to be these people. I want to thank you again for all you do to stand up for clinicians. Your commitment to the dignity and well-being of all people, a promise you have defended through dark and difficult times, is the backbone of our profession. It is the moral code that unites us. It is what will guide us through the pain and hardship of today to the hope and promise of a better tomorrow. It is now my pleasure to introduce Dr. Deborah Weinstein, the new president and CEO of ACGME, who I'm happy to say is joining the National Academy of Medicine Clinician Wellbeing Collaborative as one of the new co-chairs.
Thank you so much, Dr. Murthy. It is a privilege to add my welcome and my thanks to all of you for participating in today's event and for being the pioneers and champions, and in some ways, the backbone of the caregiver well-being movement. I am privileged to know a number of you personally and to have seen your impact up close, and it is truly impressive, and I'm confident that is the fact for all of you in the room today and those who couldn't be there but are part of this movement. I'm sorry that I'm not able to be there with you in person. I'm in my third month at the ACGME, deeply honored to be leading an organization that I've had great respect for throughout my career. Our mission, as I see it, is to continually improve the process of accreditation, and through that, to ensure the quality of our graduate medical education today and continually enhance that quality and enhance the outcomes of GME to improve health. Now, caregiver well-being, I'm sure everyone agrees, across the healthcare team is key to optimizing clinical education as well as optimizing healthcare delivery itself. In addition, caregiver well-being is essential to ensuring that dedicated, caring, collaborative people continue to be drawn to become part of the healthcare workforce. We have to keep that other goal in mind as well. Within ACGME, in the short term, we're working to strengthen communication and collaboration across all of our groups of constituents to ensure that all perspectives are considered. For instance, as standards are developed or updated, which impact the learning and the care delivery environment across many types of healthcare delivery organizations. We're also working to find ways that we can reduce burden for training programs and their sponsoring institutions. Considering the sheer number of requirements is one thing that we're looking at, as well as the details of the requirements, with an overarching goal to increase the focus on outcomes and decrease the focus on process. And our aspirations to improve the learning environment, of course, remain central. The work of the Action Collaborative and the work that each of you is doing has never been more important. Vivek noted some of the current challenges that are front of mind for many of us, and which are layering on top of the huge financial pressures faced by so many healthcare delivery organizations. Trying to meet patient needs amid workforce shortages, trying to advance and apply the scientific underpinnings of healthcare in an environment where that is increasingly challenging. But while these current challenges are daunting, important progress has been made with kudos to all of you, and more is on the way. You and colleagues across the country have helped to make caregiver well-being an explicit priority. Shining a light on burnout and on other types of distress has stimulated a wealth of research to better understand the causes and to identify effective solutions, which are starting to roll out. And huge thanks to the NAM and all of the participating organizations in this Action Collaborative for bringing champions together to share ideas and collaborate, and importantly, to support each other, as Vivek was mentioning, which certainly does have an impact. So does educating policymakers and the public about the importance of clinician burnout and well-being. And all of this helps to catalyze action. We are in a period where both patience and persistence are essential. If you feel less impactful than you'd like to as a change maker, don't we all, please continue to celebrate the smaller successes, which are all around us. While structural changes, especially those requiring significant resources, may be particularly hard to accomplish right now, do not underestimate your impact as a role model, an ally, an advisor, giving others inspiration and courage. Also, where ideal solutions aren't within reach today, we can still focus on designing solutions for tomorrow, and importantly, on helping to change attitudes, continuing to help in that realm, continuing to make seeking help for individuals more comfortable and making that help more available. Lots of progress there, more to be had. And encouraging everyone to continue to find joy in patient care as we help and support each other in the moment. Drawing strength and determination from each other and from interacting with and bringing benefit to our patients, because that's why we're here, will carry us forward in this essential work. It's now my great privilege to introduce Tim Brigham, who is my dear colleague here at ACGME. He's the Chief of Staff and the Chief of Education. He, in many ways, is the heart and soul of the effort within ACGME to address burnout and elevate caregiver well-being, including an increased outreach and collaboration with residents, as well as all other role groups. Tim is going to act as the MC for the day, and I give you Tim Brigham. Thank you.